had a facelift 10 years ago and now have a Pixie ear effect? Before the operation, I did have unusual ears, but I didn't have an unattached earlobe. It looked attached. Do you think this can be corrected?
Thank you for your question. You've submitted a question with photos of your ears and stating that you've had a facelift 10 years ago and that you have pixie ears and you want to know if it can be corrected. Well, the answer is yes. Pixie ears does happen in facelifting surgery. When I do evaluate a patient for pixie ear deformity, I basically look at a couple of different factors. Unfortunately, when people come with a pixie ear deformity who recently had a facelift, a lot of times it's because of very aggressive skin removal at the lower part of the facelift flap, which results in a pulling and tethering of the skin that pulls the end of the ear. Unfortunately, there's often a skin shortage that goes with that, so there's a compromise in how to correct that to make that look better. Usually that's a slightly different procedure, but essentially in a scenario where you're 10 years out after your facelift, there are basically two options. One is if you are ready for another facelifting procedure. Very often it's not the same procedure as you had 10 years ago, but kind of a limited procedure. Then when the skin is lifted up, the pixie ear can actually be rotated inward and sutured in a way so that it can be rounded back to normal and the face can be placed in proper position, thereby eliminating that downward pull. Now, if you aren't quite ready for another facelift procedure, well, then the pixie ear deformity can be treated as well. What is essentially done is that the earlobe is detached from the skin, and then through a little straightforward suturing technique, the earlobe is rounded so that and reattached, and that leaves a little bit of a skin defect, which is typically closed with a couple of stitches and is pretty easy to hide. So that second procedure, which is the minimal repair, is basically something that you can do under local anesthesia. And then if you wanted to do a more extensive procedure, such as another facelift, well, certainly it can be corrected at that time. So the answer to your question again is yes, it can be corrected, but a proper physical examination will help determine what direction would be recommended, and of course what your personal preference is. So I hope that was helpful, and thank you for your question.